let's talk about Dr. Oz. You know, the guy who went from hawking sketchy supplements on daytime TV to now running the Center for Medicare and Medicaid Services, okay? Like, we live in a timeline, of course, where daytime TV pitchmen are now in charge of healthcare for millions of Americans. I mean, that in itself is disastrous, okay? But it gets worse. So now yesterday on CNN's State of the Union, host Dana Bash tried to get this guy to make a simple promise. You know, like, hey, Dr. Oz, will Americans be able to afford their health care? Simple question, right? And what happened? This.
I actually did not say I was going to replace Obamacare. What I said was there are many ideas out there. Some of them could replace Obamacare. Many of them will not. There's tactics that we're discussing right now. The shutdown just ended. We were held hostage, as you know, unable to even discuss this. We didn't have actuaries in the offices. We didn't have insurance experts. All those folks are back working full speed, and we are giving the president lots of options. We have reinsurance as an option, which is traditionally used to make insurance more affordable. We have tactics that would allow Americans to play a different role than they historically have played in this marketplace.
We're out of time, but if somebody is watching now worried that they are not going to be able to afford insurance at the end of the year, are you making a promise that the president and Congress will make sure that they can?
I'm promising the president is laser focused on this. It's the main thing I talk with them about. Congress as well is all over this. We have got to find solutions that don't just work at the end of this year, but work for years to come. And I do want to come back to this theme. We have ideas that will also drop the actual cost of care by putting downward pressure on what we're paying for medications. And that's probably a very good example. If you have insurance coverage, but your medications are also better priced, the insurance you buy is enough to buy those meds, you're in pretty good shape.
All right, so Dr. Oz has nothing, okay? No answer, no answer. She asked a very straightforward question about the subsidies, and he dodged like Neo in the Matrix, okay? Instead of saying things like, yes, we'll make sure Americans will be able to afford their health care. Yes, we're working on extending the subsidies, and then maybe, going towards a more long-term solution, maybe some fixes or something like that. None of that. No, Trump's, he's laser focused, everybody. Laser focused on the issue while throwing out basically concepts of a plan. That's all they have is concepts of a plan. Still, they had how many years to work on this? How many years to come up with some sort of idea when it comes to healthcare? But they don't have any ideas. And that's the reality here that Dr. Oz does not want to admit, okay? That we have no ideas. But here's the thing. Clock's ticking. Those enhanced tax credits, the enhanced premium tax credits, okay, that helped millions of Americans be able to afford this marketplace insurance, they're gone. They're expiring December 31st, okay, and gone. That's it. Poof. All right. Look, even Trump.
Bing, 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 boom. It's gone.
They're gone. Without those credits, the average American is looking at a premium increase of 114%. That's insane. 114%. That means families who are barely scraping by are going to have to choose between their health care and putting food on the table. And it's all because of Republicans. If Republicans put a bill on the floor to extend these ACA subsidies, Democrats would vote for it. Hands down, because they don't want those subsidies to go away. They don't want the costs of health insurance to go up. It's Republicans that have the problem. But Dr. Oz cannot even promise that this will not happen. He knows, we all know, okay, that this administration does not give a damn about working people losing health care coverage. That works out for them, okay? This is exactly what we warned you about. Project 2025, okay, specifically includes a provision allowing for the enhanced subsidies to expire, to go away, and to allow health insurance to spike in price. And you know what? That's what they want, okay? Look, what they want is also to bring back junk insurance plans, which are the short-term, limited duration insurance plans that are not required to cover essential health benefits, such as like pre-existing conditions. Okay, if And now, if younger and healthier consumers choose these plans, that could throw off the risk pools and prompt insurers to exit the ACA markets completely, which of course creates a death spiral for the ACA. This is part of the plan to kill Obamacare. And they do not have a plan to replace it with anything. Okay? So, look, and whatever fixes that they have, like, oh, health savings accounts or whatever. No, what replacement ideas that they may have are probably going to suck. And look, here's the thing. I'm not exactly a huge fan of the ACA. I prefer Medicare for all. We should have done that at the beginning. But we didn't. And that's, of course, thanks to lobbyists and money in politics and conservatives. But anyway, that said, that's what I want. I want Medicare for all. Okay? But I do know here that whatever healthcare plan comes out of this administration, if there is any, okay, and if it's more than just concepts of a plan, I know that it's going to be a step backwards from the ACA. Because the ACA was the conservative healthcare plan put forward by the Heritage Foundation, enacted in Massachusetts by Mitt Romney. That's where this comes from, okay? Never forget that the ACA was the conservative healthcare plan, and Obama adopted it. And that's why the Republicans are in this mess right now, because corporate Democrats stole their healthcare plan and enacted it. And now they're like, what do we do? I don't know. I guess we just go back to the bad old days of not having anything. Because, screw everybody who needs healthcare. Oh, great. Look, getting back to Dr. Oz here. He thought he could just breeze through this interview, right? Like he was still selling snake oil on daytime TV. But Senabash was not having any of it, and neither should we. The question isn't whether Americans are going to lose their affordable health care. The question is, how many people will end up being hurt before this administration decides to stop playing games with our lives? And of course, they're never going to stop. They're never going to stop. Because this is your health care system on MAGA. If this video helped you cut through the BS and see what is really happening, then smash that like button. Every single like pushes back against the right-wing propaganda machine. I can't do this work without your support. So please check out my Patreon. Link is in the description of this video. For a few bucks a month, you can help keep this channel independent from corporate BS. So hit subscribe, hit that notification bell, and let's keep fighting for democracy and against fascism together.